Oh, well, hello there, friends and family. Good to see y'all this evening. This is Saturday evening, February the 8th, and as you can see, I'm live. I would like to say I'm well, but I'm not. I'm still struggling, trying to get over that flu. And make matters worse, it would appear I had a case of a stomach virus as well the last few days. But that's not why I'm here to talk to you. Why I'm here to talk to you is we've had some good news here in the last few days. Part of that good news is we still have only 12 confirmed cases of the novel coronavirus in the U.S. And the best part of that news is we've had 3 of those 12 patients released from the hospital. One of which was released, and that would have been our first confirmed case in Washington State, was released on the February the 4th. And it was his release that started me looking into what we'll be talking about tonight. Then yesterday, on February the 7th, we had 2 more cases that had been confirmed, and they were in Chicago, Illinois, being isolated and treated, and they've been released from the hospital. And when I looked at the reports from them, as well as the report from the young man in Washington, that's when this question that we'll be discussing comes to mind, and I'll tell you why. So, let's go on in the computer and take a look, and we'll start with what happened with the man in Washington, and then we'll hop on over and check out what has happened to the 2 in Chicago, Illinois. So come on in with me. Let's sit on down at the computer and take a look at this, and I'll explain what question I have and why it may not be as good of news as we think it is. So y'all, the good news starts right here, and this was back, like I say, on February the 4th, and this, like the headline says, first U.S. coronavirus patient released from the hospital. Good news, and I'm sure it is for him. He's glad to be out of there and back at home. But it's what's under the title that started to bother me. And it's right here. Let me highlight it for you. The Washington State man was hospitalized for about 2 weeks and remains in isolation. I said, do what? Now, I know he was isolated in the hospital, but he remains in isolation? So let's continue reading. The first novel coronavirus patient in the U.S. has been discharged from a hospital in Washington State. The 35-year-old man from Snohomish County had been held in isolation at Providence Regional Medical Center in Everett, Washington, about 30 miles north of Seattle, after first seeking medical attention on January the 19th. He'd recently returned from Wuhan, the Chinese city at the center of the coronavirus outbreak, and contacted healthcare providers after reading about the new virus, which has sickened thousands internationally. Officials publicly confirmed his diagnosis on January the 21st. That is when the CDC confirmed via testing in their labs that indeed this young man had the coronavirus, and he became the very first patient. Our patient number 1, or patient 0, however you would like to think of it. Now, the patient said in a statement that he is continuing to recover at home. Then he went on to say, he wanted to thank all the doctors, nurses, and the entire team for, the treatment he got there. He was very appreciative. But the next thing that concerned me that was written in this article is the patient remains isolated at home and is being monitored by the Snohomish Health District, the Times said, right there. So just like the sentence underneath the headline, this one here clearly states that the patient remains isolated at home and is being monitored by the Snohomish Health District, the Times said. Now, why is that important? Well, as I continue in this video, you'll see why it may be very important. But let's jump over and take a look at the 2 patients that were released in Chicago just yesterday on February the 7th. So now, this particular article that was published on February the 7th, just yesterday, Friday, from Crane Chicago Business website. And the first one, since I didn't mention it, was from U.S. News and World Report. But like always, all of the websites and resources that I use tonight in this video, I will definitely have links to in the video description below the video. So if you want to read them in their entirety or listen to some of the videos that I'll also be using tonight, then you can do that as well. And I do think that would be good of you to do. If not, do your own searches. Do your own research. Let's get on to this article. And right here it says, coronavirus patients discharged from the Chicago area hospital. And here again, right below the headline, something that bothered me. The couple will complete a period of home isolation and continue to be monitored. Doesn't say for how long, but it will say by who down here furthermore in the article. A Chicago area couple in their 60s infected with the coronavirus have been discharged from the hospital, according to the Meta Health spokeswoman. The two were discharged together to their home last night after treatment at a Meta Health St. Alexis Medical Center in Hoffman Estates. The spokesman said via email, they will complete a period of home isolation and continue to be monitored by the Federal Centers for Disease Control and Prevention and the Illinois Department of Public Health. Now, that's pretty serious. Now, I'm sure they're glad to be out of the hospital, but here again, they're at home in isolation and will continue to be monitored by our federal government Center for Disease Control and Prevention, as well as the Illinois Department of Public Health. Now it goes on to say the patients are doing well under the guidance of the CDC and the IDPH were cleared to be discharged according to the spokeswoman. Now another interesting note about this couple was this couple marked the first case of person-to-person transmission of the deadly coronavirus, which has swept through China and it infected over 30,000 in that country. And later I'll show you it's starting to approach 40,000. But here again, just like the young man in Washington State, these two have been released to their home, but for some period of time, we don't know how long, they will have to be in isolation. They will have to be monitored by the Federal Centers for Disease Control and Prevention and the Illinois Department of Public Health. Therein lies one of two questions that I have about these three patients that so far have been released from the hospitals. So let's start digging into those questions and see what we can come up with. So now where we're at is we're at one of two websites that I use to track the coronavirus, and both of them are very popular. This particular one happens to be from Worldometer. And what this website was prior to the outbreak of the coronavirus was a website where you went to get information on the latest population, global population, different country populations, as well as demographics and such. But once the coronavirus outbreak came to light, they built this website and started tracking the coronavirus cases, deaths, who was recovered, and what have you. And like I said, it's fairly popular. It seems to be a little bit ahead of another one that I will be showing you after we go through this one. But the reason this one's important is right down here. It gives you this here table, and it shows you what country, total cases, cases added as of February the 8th, total deaths, February the 8th deaths, and then total recovered. And it does this by all the countries that currently have a confirmed coronavirus case in their countries. So we'll come on down here, and this is the USA. Now we're still showing 12 coronavirus patients or cases. Over here, this is the recovered, total recovered. Now they're showing 3. Okay, now remember, neither one of those articles, whether it was on the man released from Everett, Washington, or the couple that was released in Chicago, Illinois, neither of those articles said they were recovered. They were just released from the hospital and would remain in isolation and be monitored. This website shows them as 3 of the 12 that are now being shown as recovered. But let's go over to one of the websites you've seen if you follow my channel and watch my videos that I use all the time to track this coronavirus. So now, like I said, you all have seen this here website before in my other videos. And this is a website that is was built and is maintained and updated by Johns Hopkins Center for Systems Science. And I do believe if you live in the U.S., and maybe in many areas of the world, you'll be familiar with Johns Hopkins University as well as Johns Hopkins Medical Center. It's a very prestigious, very credible and well thought of university and medical center. And this particular site gets its data from the World Health Organization, the US CDC, the European CDC, the NHC, which is National Health Commission in mainland China, and the DXY, which is also in mainland China. Now in the top left corner, it gives the total confirmed cases of 37,323, which is slightly lower than the Worldometer site. But if you look down here, it's showing 12 confirmed cases in the U.S. So that's correct. There's 811 deaths. Here again, this is lower than the Worldometer site. There are currently no deaths in the U.S. I would like to say something though. There is, as of today, we do have the first U.S. citizen to die from the novel coronavirus, and that was in Wuhan, China today. But as of yet, no one in the U.S. mainland or any of its other states or territories has died from the novel coronavirus. But then over here in the far right hand corner and column, this is total recovered worldwide, 2,636. And this particular row below it, column, is in descending order. In other words, from the most recovered to the least recovered. And you can see as we scroll down through it, the number keeps getting less and less. And it includes all the provinces in China where people have recovered, as well as other countries. And we get down here, we see 5 recovered, 4 recovered, 3 recovered. That's still mainland China. Then it drops down to 2 recovered. There's no mention on this website of there being 3 recovered cases in the U.S. And in my mind, this site is by far more credible than the Worldometer site, since it is getting its data from our own U.S. government CDC, where I'm not really sure from where the Worldometer gets theirs, or if they're making a distinction between released and recovered. Now, if you go over to a couple of sites run by the Chinese government in mainland China, they don't show people as being recovered. They show them as being cured. But this right here makes me wonder. Here is a U.S. website run by a prestigious U.S. university and its corresponding medical center, and it doesn't show there being 3 cases recovered in the U.S. And that gets me to where we're going next. A video I did several days ago. on why I think that's so important and why I believe our 3 patients that had the coronavirus are still remaining in isolation and still being monitored. So let's jump over there now and take a look at this past video. Okay, y'all. Now you might be a little bit confused. I just finished saying we were going to jump over to that video I did on January the 31st and why I felt that the case study that the German physicians and experts had done on a cluster of 5 patients in Munich, Germany, held the answers to why our first patient, as well as the 2 other patients that were released in Chicago, were still being isolated at home and still being monitored by health professionals and the health departments in their states. And I used that video for the backdrop while we discussed this, and I took you briefly through it. But then, after I finished this video, finished the editing of it, I tried 3 times to upload it to YouTube, and on all 3 occasions it was not allowed. I'm not going to include a backdrop of the specific video, but we're here on my channel, and this is where you can see the different videos that I have published, or what I can see and edit them. And the video I'm talking about is this one right here. And this video was titled "The Novel Coronavirus Alert. A paper published holds grave consequences for humanity if it holds true." And what this was about is said down here in the description. A paper by German physicians in Munich on a case study of their 4 confirmed cases of coronavirus. This study details the timeline of 4 patients from the time of contact with a known infected person from China, when they became symptomatic, the duration of symptoms till recovery, as well as their condition after recovery, and if they are cured. Should this study hold true for all cases of the novel coronavirus, there will be no way to contain the virus and stop its spread. I do hope it proves not to be the case. But I'm going to switch back right now to the channel videos. And the only thing I'm going to say about this particular video is it's not so much about the video, but if you haven't watched it, I would suggest you do. It's about the case study that the Germans did on their 4 patients in conjunction with the Chinese businesswoman that flew in from Shanghai, China, and conducted workshops at a German parts manufacturer for the automotive industry. And it was during that case study that they came up with several conclusions. Now I'm going to just jump over to a video on a press conference by the White House Task Force on Coronavirus. And I'm going to use this video as a backdrop while we discuss what was in my video and what was so important about that case study that was conducted in Munich, Germany. Now what they concluded was, based on when the people became symptomatic, that a patient 1, patient 2, patient 3, and patient 4 all were German businessmen. Now the first patient, patient 1, had direct contact with the Chinese businesswoman during the time that she conducted these workshops. Now, based on the timeline, he was infected during the time that she was showing no symptoms whatsoever. She was asymptomatic. Now, what's interesting is, since she's flown back to China, she has changed her statement and now says that she was having just some minor symptoms and that. So China is refuting the claim that the German scientists and physicians made, that based on patient 1's contact with her while she was not symptomatic, as well as patient 2 contact with her during the workshops while she was not showing signs of symptoms, that it is possible to contract the novel coronavirus while people are asymptomatic. In other words, showing no symptoms at all. And this is very unlike SARS, very unlike MERS, and this is something that makes it extremely hard to contain and control this virus. Now, they had a patient number 3 who had no contact with the young lady from Shanghai, China. He only had contact with patient number 1, as well as patient number 4 only had contact with patient number 1. And they both had contact while patient number 1 was asymptomatic and not showing any signs of the coronavirus. However, both patient 3 and patient 4 became infected and had symptoms start to show later on, past when symptoms were showing for patient number 1 and patient number 2. But the most interesting part of that case study was that once the German patients had went through their symptoms and were no longer showing symptoms, the German physicians went ahead and retested patient number 1, patient number 2, and patient number 3 by means of a PCR test. And what that test does is it looks for and sees if the virus is still active in the patient's system. If so, at what level? They call it virus loading. And what they found was that all 3 of these patients, once their symptoms had abated or ceased, all 3 still showed the virus was active, multiplying, and replicating in their systems. They had a high viral loading of 10 to the 8th power, which is extremely high. What they also found was that they were still shedding the virus. And this is what's extremely important, and I think what explains why our 3 patients that have been released, but have been released to their homes to remain in isolation. In other words, they are quarantined at their homes. They are being monitored by federal health agency as well as their state's public health agency for some length of time that we don't know. And what the Germans found was that because these 3 businessmen, patient 1, 2, and 3, were still shedding the virus, they were still infectious. You see what I'm saying? Now, they did something a little different on patient 4. They tested him via a PCR test while he was having symptoms. And the only thing I can figure there, they were just trying to discern whether this coronavirus was similar to SARS and MERS and other coronaviruses, which all are infectious during the symptomatic stage of it. In other words, during the period that you are showing signs of the virus, symptoms from the virus, you can infect others. But it was patient 1, patient 2, and patient 3 that was most concerning to me, and meant that not only could you infect others prior to the onset of symptoms and were asymptomatic, but after you supposedly recovered from this virus, showing no more symptoms, you were still infectious for some length of time. And as of yet, I've not been able to find anything on how long that is. And to me, that addresses my first question, was why we have isolated these people in their homes and are still monitoring them. Now, the second question would be, how long is this going to be for? Is this going to be for 2 days, 5 days, 10 days, 30 days? Well, apparently right now we don't know, because here again I can't find out any information on that. Or is it, as I suggested in that past video, is this going to be like some other viruses, where once you are infected with the novel coronavirus, are you a carrier of this virus for the remainder of your life? Because if that's true, then for those of us that are yet uninfected, there's no way we can remain isolated long enough, and I don't care how prepared you are, and keep from being infected at some point in time. Even if you wore masks, even if you always washed your hands, always sanitized everything. I mean, nobody's perfect. Eventually you make a mistake. So for those of us not infected at this time, our only possible way of not being infected would be if they came out with a cure for the novel coronavirus. So let's jump back to another website. And if you want to watch this coronavirus task force video, I'll leave a link to it in the video description below. And you can start right here at 28 minutes and 45 seconds and listen from there. And that's when you'll hear this man here, he's from the CDC, talk about, yes, it being transmittable while patients or people are asymptomatic prior to the onset of symptoms. And you'll hear him say something later on concerning our 12 confirmed cases in the U.S. And he only touches on it for maybe a sentence. It's very brief. And all he says is, at this time, we still have only 12 cases confirmed in the U.S., all of which remain quarantined. Now you can look. This video was streamed on February the 7th. If I remember correctly, this press conference went on, I think it was about 10 or 11 a.m. on the 7th. So this man right here knew that the first patient in Washington had been released from the hospital. He also knew the two in Chicago were either had been released or were going to be released. And the reason I say that is because before these coronavirus patients are released from the hospital, the CDC has to be conferred with and approve their release, as I stated earlier in the video. Like I say, let's drop back over to John Hopkins' website and discuss this more, and maybe this time YouTube will let me upload this video. So we're back on the John Hopkins website. I just refreshed it. And just in closing, I'd like to say, this link will be in the video description below as well. It shows 12 U.S. confirmed cases, but over here on total recovered, there's no mention of 3 being recovered in the U.S. That, along with the article from the U.S. News and World Report and from Crane's Chicago Business article, saying that those 3 patients had indeed been released from the hospital, but were released to their homes. They remained in isolation, and they would continue to be monitored for some period of time. That's what started the questions in my head and the wondering. And I'm hoping that you watch this video, seeing what I've presented here, you'll wonder that as well. Because the question's out there. Are these people still infectious? If they're not, then why are they still being isolated and quarantined in their homes? Why are they still being monitored in their homes? And if indeed they are, how long? How long is it going to be? Well, I'd have to say right now, folks, we don't know. We'll know when they no longer have any virus in them, if that ever happens. And the only way they're going to be able to tell that is if they bring them back in and give them another PCR test, which will then confirm if the virus is still active within their systems. Is it still multiplying? And are they still shedding it, which means they're still infectious. My hope and prayers are that at some point in time they will show negative on a PCR. Because like I said, if they remain to test positive, therefore they remain to be infectious, then my hope, my daughter's hope, many of you all out there that are my age or older, also many of you out there that have underlying health conditions, your only hope is going to be one of 2 things. One, you contract it, the novel coronavirus, and you survive, which in past videos I've showed you what percentage of people die from this in our age group. If you're a male, you're 3 times more likely than a female to die. If your age is 54 and above, you're in the second highest mortality group. If you have underlying health conditions, you're in the third highest mortality group. And if you're a combination of any two, I'm a combination of all 3, then who knows whether you can survive it or not. And the thing that bothers me the most is nobody has picked up on this. Nobody has asked questions in the mainstream media as, well, why are these people being isolated at home? Why is there still a need to do that? I mean, if I was a paid journalist, I'd have to ask that question. I mean, it came to mind as soon as I read the articles. I think it came to your mind too. So why aren't they? Secondly, why is not our government here in the U.S. asking that question? Our government officials that you just seen previously in that press conference asking why from the CDC. And maybe they have. Maybe they're just not willing right now to tell the public at large. And as I've said, I've tried to upload this video 3 different occasions, and I failed. I'm going to try it again. This will be the 4th. And hopefully, since I didn't linger on my video that was discussing the German case study in Munich, it was published in the New England Journal of Medicine, which is a very prestigious, #1 prestigious journal of medicine in America, in the U.S. I'm hoping this video gets up. It's 11 o'clock at night. And I've re-edited multiple times, and now I'm going to try it again. I don't know what more I can do to get this information out there, so you'll be aware of it. And I'm not wanting to create panic. I'm not wanting to promote fear. I mean, I don't even care if you go watch that past video. I hope you do. And if you did watch it and can't remember it, I hope you'll watch it again. And all of you have got to understand this. The channel's not monetized currently. I can get 1 million views, folks. I don't get 1 red penny. And I wish all of y'all would do me a favor. If you have to watch a commercial during any of my videos, I hope you'll send me an email and let me know. I hope you'll take a screenshot of it, or even record it on screen and send it to me. Because if that's happening, me and YouTube got a far bigger issue, and them just not allowing me to upload a video tonight. And this has only happened 1 other time. Now I will say this, and I said it in the past video, because I am covering the coronavirus. And why? Because I love my children, I love my grandson, I love my friends and my family, and I've become friends with so many of you out there. Like I said before, I know your personal experiences. I know what you're going through. You've shared them with me in the comments and in emails. So I'm aware of it. So I've become to know you as well. And we've become friends. And we are a community of like-minded people, I would think. So folks, that's all I have for tonight. I'm going to give it 1 more try before I lay this head down to rest. I want to leave you with this. I want you out there taking care. Please prepare the best you can. Stay safe. Get alcohol-based hand sanitizer, at least 70%. Get wipes that are rated to kill viruses. Don't get wet ones. They just kill bacteria. Don't get baby wipes. They're for bacteria. I use the Clorox wipes, same one I use in the kitchen. They're not so easy on the hands, but right on the side, just like Clorox bleach, 99.9% kills viruses. And that's what I use. And I take them and I put them in my own Ziploc bag, and they go wherever I go. Now I also have 70% alcohol hand sanitizer I take with me. And I use those wipes to wipe down everything I touch when I come out of anywhere. Even my outside door handle of the car, the inside door handle, steering wheel, gear shifter, my keys. And I do it over and over and over again, as I did today when I went out. Thank God I only had 3 places to go. So you're gonna have to be vigilant out there to keep not only from contacting the coronavirus should it get close to you or in your area, but you need to be doing that for influenza, because influenza is extremely serious in the U.S. right now. Just look it up. It ain't pretty, folks. And as always, I want each and every one of you, your families and friends, to be blessed by God. That's my true desire. And I want all of us to pray for all of us. Not only here in the U.S., but in China and around the world. With that, y'all, till I see you on the next video, I'm going to wish you a good night. I'm going to finish editing this video, and I'm going to give it one more old engineering college try to get it on YouTube for you to watch. Take care, and later on.